So you do most things as a dentist. I told you in the green room that the slang term, which isn't a real term, but super specialist. Like you do everything right there. And you say patients like that.
Yeah, absolutely. It was out of necessity, honestly. I would see patient after patient with all of these complex needs. And I learned very quickly that once I started to break out the referral pad and, send them to this doctor, send them to this doctor.
Like the root canal
The root canal guy, the periodontist for their gums, the oral surgeon for an implant or extraction. Very quickly, I could see the confusion and the hesitation in their minds because they're like, I like you, doc, but I don't know these guys. I don't know their staff.
Okay.
I've got to drive across town to get this, 5
times. Because people don't like the dentist anyway.
They don't like them anyway. They don't like one dentist. They don't like 4 dentists. They've got to meet 4 different doctors. It's scary.
Okay.
So once I learned,
So a lot of continuing education.
hundreds of hours of continuing education where I am confident in the procedures that I do. Now, occasionally I will refer out, of course. I'm not God here, but I will refer out procedures that I am not comfortable doing.
Okay.
But the vast majority of the time, I can structure it where all of the work is done under one roof with these hands, with my hands.
It's less people to pay too.
Oh my God! It's logistics. It's just the idea of I've got this appointment. This guy accepts my financing. This guy doesn't accept my financing. I got 5 different bills. I mean, they don't like this problem anyway. Now it's another problem just dealing with it. If I can just say, here's a plan. This is what we're going to do. Here's the fee.
Good.
Here's the financing. Would you like to do it? I see just a wash of relief. Like, oh, thank God, this is it? And the number one, you're not sending me to anyone else? No, we're doing it all here. Thank you. That I have that conversation almost every day.